Hello, everyone. Good morning, good afternoon, good evening from wherever you are joining us in the world today. And welcome to another episode of the Realist Lens for researchers who keep it real. There have been many attempts to explain and develop ways to analyze data in realist research. From realist thematic analysis to QCA, these methods all aim to help us make sense of our data in a realist way, uncovering those hidden context mechanism outcome configurations. One approach that's gained traction is the use of dyads and triads. Since the publication of Jackson and Kohler's paper, a new realistic evaluation analysis method, linked coding of context, mechanism, and outcome relationship, this approach has been used in realist research. But what does it actually look like in practice? And how can it help us make sense of complex data in our own projects? Joining me today is Suzanne Jackson, who's here to talk us through this analytical approach, how it's evolved over time, and some exciting recent developments, including adaptations that make it more accessible for participatory research. I'm really looking forward to learning how this approach can support analysis. Suzanne, good morning. How are you today?
I'm fine, thank you, Alejandro. That's great to be here.
No worries at all. Thank you so much because it's something that I've used myself and I found so useful in my own research and in the own projects that I've done. And I'm really looking forward to hearing your thoughts and the evolution of it as well over the years, which I know that these things are dynamic and change and certainly also through your own experiences you've seen it evolve. But just before we get started on some of the more specific questions around the approach, would you mind just please introducing yourself and your work in the realist approach so far?
Okay. I'm Suzanne Jackson. I'm currently an associate professor emerita at the Dalla School of Public Health at the University of Toronto. So I retired in 2016, but I'm still active in some research projects, and I have been invited back as the interim program director for the Masters of Public Health in Health Promotion at Dalla for the last 4 years. But I'm retiring again this June. And my research has been largely focused on participatory research. I've been using that since the 1990s as my main way of conducting research. And so the realist approach also came out of two things. One, in health promotion, because we want to change the context as part of the actions of health promotion, it becomes difficult, very challenging to evaluate. So I was looking for other mechanisms for evaluation than the traditional ones that are usually used. And the realist approach just seemed like, okay, here's one where it's actually talking about the connections between context and then mechanisms and outcomes. So I could look at it very differently. And instead of trying to hold the context constant, which is what randomized controlled trials and other kinds of evaluation research does, I can use the context and then talk about what works for whom and when under what conditions. So in one of my so that was the beginning of my thinking in that area, and I was actively trying to pursue how can I do this. And when I looked at the and this was back in the late 2009 8, 9 kind of period. At that time, the realist approach was mainly used in literature review and not so much in empirical research or in qualitative research. And I'm a qualitative researcher. That's the other thing to know about me. I'm a participatory researcher. I work in the health promotion field, and I've worked in the health promotion field for 40 years. And I'm a qualitative researcher. I'm not even mixed methods really. A qualitative researcher. So in one of my projects where I was working with the staff at the in early parenting programs in Toronto. So we were in a long-term relationship and I had done a variety of different kinds of evaluation research with them. They were coming to me with a concern that they had that the City of Toronto Department of Public Health was introducing and requiring all of the staff across the whole city to use two particular peer-reviewed early parenting programs, and they were very specifically laid out, and they had to be done in a very specific way, following what had been researched and found in the literature. The challenge that these staff came to me with was that this doesn't fit in our context. We need to use, or we want to use, or need to use community parents as part of our programming, and they won't. the city does not want us to use these parents as part of the programming because these programs have been researched and shown to be effective without these community parents. And so they were talking about how their context didn't quite fit. And I thought, oh, here's a really nice opportunity for us to start working and figuring out what that difference in context means for these particular programs. So they were inviting me in to work with them and figure out what we could do. So we did some interviewing with the public health nurses who were delivering programs, working with the community parents, public health nurses who were not working with community parents, parents themselves, and participants, community members who were participating in the programs. And those interviews could be analyzed by using typical qualitative research methods. But I was looking at how can we look at this much more specifically and look much more clearly at the context, and can we do this in a rigorous way? So then I thought, okay, let's see if we can explore the connections between context, mechanism, and outcome. The issue was really and there was some literature around how to connect these, but they were done, how can I describe it? They were done, here are all the contexts, here are all the mechanisms, here are all the outcomes, and the researchers kind of make connections between them. And I thought, what about if we could do something much more tied and much more specific that's embedded in the interviews themselves? And what I found interesting when I looked at the interview transcripts is that people naturally talk. Almost every sentence could be coded as a context mechanism outcome type of relationship. Like some of them were C for context, M for mechanism, O for outcome. Some of them were COOs, some of them were CCMs, some of them were like they were different combinations, but they were still talking about just in their heads and their experience, naturally talking about these connections. And I thought, wow, that would be really interesting. So we set out to code the data that we had this way. We did code it the traditional way, and got some information from that. But then we decided to look more specifically at this from a realist perspective and develop this coding mechanism. This happened over several years, 3 years, I think. And I had different students working on it. Jillian Cola and I did the bulk of the work on it in terms of figuring out what this actually looks like. And we did the initial coding, but thinking, okay, we'll find some common features like you would in any qualitative theming method, except that we had over 700 unique dyads and triads. Like it just, they were not in common. It was like, oh my God, over all of these interviews, we all have so many different unique combinations. So we had to find some other way to figure out how to reduce that volume of information and make sense of it. So the category that had the least number of categories or topics covered were the outcomes. And that makes sense in some ways because the outcomes are some of the things that you really want when an evaluation process and you really want to understand what those outcomes are about. So we use that as the axis for connecting the context to mechanisms. And one of the key things that we were looking at was whether the community parent was necessary or not necessary, since that was the main question that was being asked by the staff. They were asking what was the particular role of the community parent that needed to be there in their context. So we looked at mechanisms that had the community parent, that required the community parent to be present, or contexts and outcomes that required the community parent to be present, and outcomes that did not require the community parent. And one of the things that really interested me is that they so clearly divided. There was not a gray area where you kind of looked at it and you think, oh, they're sort of involved and sort of not. It very clearly divided in people's experience and in the way they talked about the program. They very clearly had particular outcomes in which the community parents were involved, and particular outcomes where it was mainly only the PHNs, the public health nurses. So that was interesting in itself. And then when you look at when the community parent is involved and when they're not involved, what were the differences in the contexts? Like what context was the community parent there and what context were they not? And so you could again see some clarity around which contexts were important, which ones were not. And then in terms of the mechanisms, it was around what the community parents are doing in particular that makes a difference. And that was the way we approached that research. Very interesting to go through that whole process and look at these dyads and triads and how they became relevant if you clustered them in this particular way.
Suzanne, thank you so much for such a detailed exploration of your thinking and the journey that you went through discovering this process of diets and triads. Because one of the things that I found the most useful when using the approach is certainly what you've mentioned, that it avoids the cataloging of this is just context, this is just mechanism, this outcome, because it's not realist.
No,
Realist comes in the configuration and in the domino effect, so to speak, in the links and the change that you're making. So just thinking that from the get-go becomes so useful just to get those, even when you're just highlighting in Vivo, Atlas TI, in Word, whatever you're using, to really get a sense of what's going on and thinking retroductively. Certainly that's helped me. And you've described the initial ideas of how this came along, but you've continued to develop this linked coding methods since the original ideas, since the original
mm.
project that you're talking about. So what motivated this further adaptations and how have they helped you for participatory research?
So in the next real iteration of it, um, was it really came out in a project that I was engaged with colleagues around community resilience. So we were trying to explore community resilience in relation to climate change. And we'd identified, and we were working closely with the Center for Connected Communities in Toronto, which was an organization across Toronto, which engaged local champions and local organizations in their organization. And so they were very community grounded. And so we were working with them. And then we had, through them, identified 6 neighborhoods in Toronto that were made marginalized by Toronto society. And they were low income, usually with high migrant populations, and often facing resource constraints, food deserts, lack of access to healthcares, and that kind of thing. So the question that we were talking about was, okay, in these communities, there's actually a lot of community resilience. So, what is it about community resilience in what is it about these contexts in each of these neighborhoods that enables or makes community resilience easier or not easy? And in the process of starting that research, which we started probably 2017, 16, 17, and we started down that path. And then just as we were about to go into the field, setting up our process of doing interviews, et cetera, COVID hit. So we pivoted. So in March 2020, we pivoted to, or in April, March, April, May, shifted our ethics review and pivoted to look at community resilience in relation to COVID, but basically the same kinds of questions. What is it about the context of these neighborhoods that is connected to their resilience in the face of a disaster, a major challenge like a pandemic? But because this was a participatory research project and we were engaged with community members through this Center for Connected Communities, we were trying to figure out how do we do this in a participatory way. We also really were interested in a realist approach. We really wanted to know what were the connections between the outcomes, the mechanisms, and the contexts. So we thought, okay, we'll do the interviews and then we'll work on the analysis. And I just looked at these interviews. They were lengthy, much more lengthy than the community parent interviews, and full of rich detail, of course, because these are people who really wanted to talk to us about what they were experiencing. And I thought it's going to be too long and too tedious for us to break these into dyads and triads for each line in the interview. And we don't have time for the length of that analysis because they really wanted the results to come out fast so that they could act on them. So one of the issues that you face and I have faced in the past in these participatory projects is that people want research results faster than the normal research process would enable us to do. And I've faced that many times where we have it's going to take us a year to analyze this. Just wait. We'll get the results out to you. But from a dyad and triad point of view, it's going to be even longer and require incredible time and resources to create these dyads and triads and then analyze them. So I thought there's got to be another way, and there's got to be a way that we can engage people in the process, not just as interviewees. And so I think in my earlier paper, I talked about how important it was to look at the interviews themselves and how people were thinking about the questions that we were asking, and that they naturally made these connections. And rather than ask them specific questions like what's your context and you know, what's your outcome and that stuff, you just ask them to talk. And from that you can develop what those link, not necessarily even codes, but how those ideas link together in what they and how they talk. So that's one way of doing it, but the analysis falls on the researcher. It doesn't engage the participant in this. In this research, what we wanted was a participatory process where people are engaged, community members are engaged in designing the questions, which we did, but also in the analysis. So if they're going to be involved in the analysis, how do you do that when it's a level of expertise and understanding that's challenging, and to ask community members to get a grip on all of this and become experts in this is a tall order, especially when you're trying to do it on a basically volunteer basis. So we tried to come up with a different way of doing it. So I was the main analyst on this one, and we analyzed each of the interviews. And I did look at the sentences and made notes basically on the transcript about what links I was seeing in the way things were being phrased and how they were talking about it, so that there was a series of linked, not necessarily codes, but linked ideas going down the margins of the interviews. And then we talked through at the end of the interview, what that particular person was mainly saying about their context and what they were mainly talking about in terms of the mechanisms that they thought were operating and what they thought the outcomes were, not necessarily as specifically tied to the dyads and triads as it had in the previous research, but like a summary of the main points that they were making, and roughly a little bit of a hypothesis of what their overall links were, like how they would link all these things together. So each person had like little hypotheses attached to them. And this meant that for the 42 interviews that we did, there were these sort of summary comments, and we could make some sense of what they were talking about and then share that with community members. And we went through, they read the interviews or interview transcripts and then looked at the way the analysis was framed. And then we talked about how that was an accurate or inaccurate reflection of what they saw in the interview, compared to what I saw in the interview. And of course, there's always great insights that come from the community members when they're reading the same material I'm reading. They see different things, and they had some uh, great comments and insights into what was there. And this is the way that we also divided them up by neighborhood, so that one or two community members were reading all the transcripts from one neighborhood, hoping that that brought some of the contextual elements together in common. Not always, but generally that happened, so that we could get that sense clustered that way across the different interviews. That made it much more manageable, and we were able to develop um, our hypotheses, and the main points that were coming out of these interviews, and how we would talk about them in our research. And that's what we ended up publishing in the paper that I published. Not I, but that we published. We also, in the interests of having a really close look at the context, asked community members to give us a profile for each of the 6 neighborhoods, so that they described the historical context, some of the population and cultural details, etc. In the end, that did form a bit of background, but it wasn't directly relevant to the way we formulated linked, context, mechanism, outcome stuff. It was a little bit different. Plus, I should note that we added in from Punton et al. The concept of an intervention, because I think there's always been a little bit of confusion around mechanism, the term mechanism, and what it means in when you're talking about a realist approach and a realist analysis. Context relatively clear, outcome relatively clear. Mechanism is subtle. It's about some of the conditions and the underlying thinking that forms a mechanism, but there's also a direct intervention that's present. So the Punton et al. Group created CIMOs, so context intervention mechanism and outcome, and that helped clarify things. So that's what we did in this, is we also separated out those concepts a bit so that we were able to highlight the intervention components or the action components as well as the mechanisms.
Well, Suzanne, I feel like I've just been transported into your research journey and taken me through all that detail and through all that process that in papers we can't go through that in a way, like through that detail, and to really see how the thinking and the decisions and the justifications of these things come along. So I found it fascinating just listening to that. And also the decisions that in realist work being iterative that have to be made, because it seems like the initial dyads and triads for this particular project, so the needs of the projects and the timing and the constraints that you had to be adapted, and it felt like it was a good outcome getting these linked ideas together in order to help you from that perspective.
Yes, at least I like to think that.
Yeah, and I guess that in your experience, you've used both very much so, the dyads and triads, and then as it's evolved, this linked coding practice that's also seems to have helped in this participatory approach, also getting community members very involved, which I find fascinating. How do you feel that this process specifically of making those links very explicit from the analysis and not, at the start of the analysis as you're coding and not afterwards, how does that help shape your understanding of program theory and of this configurations? What is the benefit of the approach in your eyes?
I know you had posed that as a question, which I thought was a very interesting idea. I think for me, it's that the linked coding, either method, either the more adapted method or the dyad and triad method, allows the program theory to be developed from lived experience, both from staff and from participants. It comes directly out of that lived experience. And to a certain extent, by not a priori coming up with what those relationships might look like, you're giving the chance for the program itself to an understanding of how the program works at a very concrete level in the community. It gives us a chance to really think about what adaptations are necessary and how programs actually work when they're on the ground. I've always been disturbed by the concept that you would have these RCTs and then you would develop a program, and then this program is what you're going to use. And I've always been disturbed by the fact that no context was ever going to be like the one that you tried to standardize for that research. And therefore, it always has to be adapted. And then there's the sort of idea that, again, it's an example from the city of Toronto where this research had gone on to really show the effectiveness of these particular programs for the early parenting period. And yet, the contexts in which that research was done did not match the contexts that it was going to be applied in. So the the theory is present, but there's a nuance to the theory. The theory that in one of the programs, for example, it was filming mothers in interaction with their children and then showing the mothers the films. And then they would learn some things by watching how they interact and then discuss watching how other people interact, and then they discuss the what would be a better way to do it. That is not changed by the context in which you operate. That seems to be a very effective methodology, no matter where you do it. But it makes a big difference when you're trying to work with a different population with a different cultural background, and whether they're even willing to come into a program like that So, what we found is that recruitment and retention in these programs is a very important component of getting the program to actually work was not addressed by the way the program was originally conceived. So, in terms of theory development, the theory underpinning the overall design of the program from an early parenting learning point of view is fine. But the theory around how you get people to engage and be part of this program was absent, was empty. So it's like there's nuanced pieces of the theory that become important. And I think you can't explore that unless you really spend some time thinking about what difference does the context make and how do you deal with it.
Couldn't agree more. And that was again one of the areas that really attracted me to the realist approach, that it doesn't try to simplify context. I think that in the social worlds that we're interested in, and the complexity is real life, particularly as you go outside of the lab, or those conditions that are being attempted to be controlled. And I say attempted because there's always subjectivity within the objectivity, that you're trying to the decisions that you're making in an RCT as well. But yeah, I find that so interesting. And you mentioned the importance of context, and of course, in this approach, in this analysis approach, the context is very much linked to the other areas, because that is the important thing, this configuration. But as you've developed the approach and as you've gone through all these different evolution and iterations, I'm sure as well that there has been challenges, or maybe a lot of red crosses in your notes of thinking, oh, maybe not this way, and then another way, maybe not this way, and then you had a little eureka moment. So, what in your experience going through all this process, what have been the challenges when applying this approach to complex data? You mentioned one, for example, around timing, that it may take quite a long time if you have quite a large piece of data and it has to be adapted. But are there any other challenges or unexpected things that happened along the way?
Yeah, the time is one of the biggest ones. The expertise or the consistency that's required to really understand what we mean and that there's consistency between the people who are involved in doing the coding. You must have found this also in your work trying to do this as well. But when you have more than one person coding to really test quite a lot, that you have very, pretty consistent ideas of what the mechanisms are. And I think that's one of the areas, again, as I explained earlier, that is challenging because it's so subtle and it's present, but it's a really challenging concept, I think. That's where I found the CIMO to help,
Mm.
because then you could really split out what the intervention is, which is what I found some of the students and I were discussing was the same thing as a mechanism. And then we were finding, no, it's not exactly. And how do we understand the difference? It's challenging because of and I'd be very interested to know about your experience in your application about the time and the detail involved, because looking at each, as I said, we looked at each line of the interview, like each sentence in the interviews initially, and then the next time I did it, we were looking more at the overall content of the interview and what they were saying about the link rather than trying to parse it out to each sentence, because it's very time consuming. And was trying to figure out whether the benefit was greater by keeping it very tightly parsed to the sentences, or whether you could get the same results by summing it up by paragraph or by interviewee or something. So I don't know if you found anything in that, but
No, that's really interesting. And in my experience, what really helps for going through an analytical process, because there was three of us essentially doing the analysis, was being very clear around our definition as a team of what context means, of what mechanism means for us as a team, and what our outcome means. And for that particular project, we're actually using ICOMO statements. So intervention, context, actor. So who is the individual being impacted by the intervention?
uh,
Mechanism, outcome, which is another conceptualization of CIMO, ICOMO, CMO. There's a lot of them at the moment that are, as you say, going into the specifics to try and break it out. Essentially, I think that the key is that configuration, whatever you're using. If you're thinking in a generative way, i.e., looking at those mechanisms that have powers and effects and are impacting in those outcomes that we see in the experiential level, in the things that are going on. And that's what's important. But I think that the definition was super important, because then we were clear into when we were doing our transcripts and into what they were. And then we swapped transcripts, and then we looked at each other's and looked, okay, what are the dyads and triads that we found that have been similar, and which ones have been different, to learn from that process from each other as well, to then go into a synergy process, a little bit the cluster that you've mentioned, to go into more explanatory statements afterwards. So I think that alignment within the team of what we mean by those words, because as you say, they've been defined in different ways, I think certainly is one of the most useful things that we find in our analysis process.
Yeah, that's great. And I think, yeah, so that's the main challenges that I think, um, and you've described some ways of getting around those challenges. I've tried some of those myself, but yeah, that's the main things I find with it.
I think when you're dealing with analysis with more than one person, I think it's alignment. I think alignment is so important in every sense, and particularly in the analytical approach, that you're using a retroductive reasoning. And we're going to have an episode on retroduction for those who are wondering what is retroduction, because it does sound like a bit of a complex word, but we do have an episode of that coming as well. But as long as everyone is aligned and looking for those and going through that reasoning and process and being very transparent about that, I think that becomes extremely useful. Suzanne, we've mentioned some of the things together, and I've really, really loved hearing your experiences. And again, I felt like I was there in the team as you were going through all that process. That again, in a paper with word limits, we can't really go into, but
No.
and and all the things. But looking back at all this process of analysis, there may be some individuals, researchers, PhD students, evaluators who may be considering using this approach, dyads, triads, linked coding, and the developments that have happened since then. What would be the top 3 tips you would say to those individuals who are trying to apply this kind of analysis within their work, and they may be going back to the research, they want to try it out, or they want to see how it works for them? What are the top 3 pieces of advice you would say to those individuals?
Interesting question. I guess it's the top 3 tips would be, as you just pointed out, to be clear if you're working with a team, that everybody is aligned around the same set of um, definitions and understanding of what context, mechanism, intervention, actor, whatever outcome, what they are, so that they can be pretty consistent in their coding. And I think the second tip is that early discussions of what you're finding, so that you're getting a common map of the, how would you describe it, the individual codes. In a qualitative research project, you might have a code book. So you would be sitting there all working from a code book, that you have some discussions amongst each other, so that you've got some of the categories at least in common, so that context 3 is the same across everybody's, and you know what it is, and it's described pretty well, so that you've got some sense of what this code book could look like for the individual components. The link discussion comes later, but for the initial coding, you need to be clear about what each of those pieces are, and then in each interview, they're going to be linked. And that's a piece that has, again, I always wanted to think about having the links describe themselves as a coded item, but well, that was impossible. I just could not figure out how to do that. So instead, looking at the linked grouping and not splitting that out, like not taking that apart, but really looking at the links across those 3. So that would be the third tip, is that you really have to pay attention to those, that these are linked. They're not separate. And you have to talk about the links that you see across all of these different pieces and look at them as a group. Look at all the different CMO configurations, as I said, by dividing them into one cluster around one kind of outcome or one kind of intervention, whatever you're using to initially organize your data. Look at the links that are talked about there and see if you can see some patterns in those links, because that's the next most important thing.
Number 1, alignment with definitions. Number 2, that early communication with the coding. And number 3, pay attention to those links.
Mhm.
That's a nice little summary of the top three tips. That has been fantastic, Suzanne. I really enjoyed speaking to you and listening around your thinking and the process of these things. Because of course you see the sometimes the final product, no, but all the thinking and everything that goes behind that, and all the work, and I'm sure your evenings in front of a book, or a computer, or just your notes thinking into how can this work. I find it fascinating hearing your thoughts coming along, and I've really enjoyed speaking to you. I only have one last question for you though, just before we wrap up, which is, you say you retired once and came back. You're retiring again. Are you going to be swayed again, or is this a full stop now?
Well, in the previous retirement, I was still very active in doing research. So I was still involved in a research project and still have colleagues. I'm still involved in another research project. So it's not a retirement from research, it's a retirement from the academic administration stuff. I still do guest lectures, I still do that kind of thing, and I still review journal articles and that kind of stuff, but I'm not doing the administrative stuff at the university.
That sounds absolutely fine. And I wish you all the best in that chapter that you're going through. And I've really enjoyed talking to you and hearing more around the process of dyads, triads, linked coding, and your thoughts on that. And for everyone else listening, thank you so much for listening to another episode of the Realist Lens. I hope you found it useful. I certainly did. And Suzanne, thank you so much for your time.
You're very welcome.